Morning, guys. It is just a little before 5. I'm on my way to clinical. Most of us like to get to the OR between 5 and 5:30 depending on the rotation, and on the way there I usually drink my coffee and listen to a lecture. This morning I'm going to listen to some pharmacology. It's from a previous semester, but all the lectures are recorded, and I know it's super important information for me, and it kind of just helps it stick to re-listen to it a couple semesters later. It's a nice way to help me wake up and prepare for my day. Okay, so I made it to the hospital. I just wanted to take a second and talk about clinical prep. So before every clinical day, the night before, I and all my classmates write what's called a care plan. If you know anything about anesthesia school, you may have heard about care plans. They're very daunting. Everyone kind of talks about them. So essentially it's a plan of care for your anesthetic for each of your cases, one of them in depth. And what that means is I looked up everything about my patient in their chart. So all their comorbidities, all the medications they take, past surgeries they've had, how those surgeries have gone, wrote up all those things, basically how they are pertinent to their current situation, how they'll affect their anesthetic today, wrote up how I plan to run that patient's case, so how I want to put them to sleep, how I want to wake them up, things I'm worried about, complications, things like that. I would say right now, where I'm at in the program, the average care plan takes 2 to 3 hours. I've had them take as long as 4 to 5, and I can also get some done in as short as an hour, so it just kind of depends on the patient and the case. Last night I was writing my care plan for a little over 2 hours. And then you also, aside from the one patient who you write a care plan on, you also look up the rest of your patients. So let's say you're doing 4 cases in a day that are scheduled, you'll write a care plan on one, but you'll also look up the basics on your 3 other patients. So all in all, before every clinical day, you'll spend anywhere from 2 to 5 hours prepping. So it's definitely a ton of time, and because you get up so early, you have to be good at not procrastinating, because if you start too late, you'll be kicking yourself when your alarm goes off at 4:30. So just wanted to speak about that, but for now I'm gonna head in and get my scrubs, so I will see you in the OR. We made it. Now I'm gonna do my morning setup, which involves checking the anesthesia gas machine and drawing up medications and kind of preparing my airway setup for my first case of the day. So I will let you guys watch that. Enjoy. Okay, my OR is ready to go the way that I like it, so my SRNA isn't here yet, which is the goal, to have it ready before they get here. So I'm gonna leave her a note and I'm gonna go see my patient in pre-op. In pre-op, I'll do an assessment, see all their comorbidities, see if they're accurate in their chart, kind of make a plan for how I wanna intubate them, any complications I foresee based on assessing them, and then we will go ahead with our case. It's 3:45, just finished my second case of the day. Like I said, our clinical days are scheduled to 3, but you never really know how long you're gonna stay. Today, I wanted to finish my case. I put my patient to sleep. I wanted to wake them up, so it was a really good day. Now I'm gonna change, head home, decompress a little bit, and see you guys there. So I made it home, had a snack, took a break for a little bit. I'm gonna take my dog for a quick walk, and then comes the hardest part of the clinical day, which is actually studying afterwards. So most clinical days, I have too much to do during the week to be able to afford to take the night off after clinical. So the hardest part is coming home and finding the energy to continue to study, and yet we all do it. So tonight, just for reference, I'm gonna try to get through one chapter of my textbook, one round of flashcards that I made for simulation lab that I have coming up, and then maybe work on a presentation as well. So I would say I'll put in at least 3 to 4 hours of work before bed. And some nights it's even later. Tomorrow I have class at 8 a.m. so I don't have to get up at 4:30 again, but definitely the hardest part is studying afterwards. It's very tiring to be at clinical and have your brain turned on level 10 all day, and then to come home and have to do more is tough, but this is what I signed up for and I'm lucky to be here. So thanks for watching my day in the life in clinical, and good luck to you guys.